what percent of the cohort will be children? And I can't leverage a guess because I don't know. Dr. Dishman's going to need to help us with really figuring out what this is going to look like. But what I can tell you is about in November, Josie Briggs, who was the acting lead for PMI and is one of the other IC directors, asked me to lead a group to evaluate how could we bring children into this cohort. And in fact, it included how do we bring people across all ages, knowing that, we certainly know how to bring children in. We can bring families into studies. We do this all the time at NICHD. And we reached out to other colleagues from Heart, Lung, and Blood and from aging to say, okay, well, how do we bring that population in as well? And so we had specific questions that we answered, and all of this information will be given to, and probably already has been given to Eric as well, so that he can look at that and say, okay, these are how other studies have done this. One of the thoughts that has really been brought around from a number of the interactions with communities was the thought of bringing children in through the enrollment of families. So if you have someone who is interested in PMI, to include their family in PMI as well. And I think that allows an opportunity to perhaps be more successful in keeping that child in because the whole family has bought in, or at least part of the family has bought in. So I don't know. I think it's also going to depend a little on how robust the interest is of people to enroll their children and what will they get out of it. So I think it's an unanswerable question, but it's an important question for us in how we format that request and then how we engage people to enroll their children. And I would encourage any of you who have ideas on how to best do this, feel free to send us your thoughts. We're always open to taking additional information.
Yes.
Kathy, thank you so much. It's not a question, just to thank you for your leadership at the NICHD. Lucky Jane from Atlanta. Also, to say that your leadership in advancing mother and child, the cause of the mother and baby, and now the older child. We truly appreciate your leadership. Thank you very much.
Thank you, Lucky. And I think it's been so interesting for me as I've gone through my career, where initially the studies that I was doing in obstetrics, what was the outcome we went for? We went for an APGAR score, right? And that's just not acceptable, okay? The child begins in the womb, but the outcome has to be that child. And we have to do these studies that really look at how is that kid doing, not at birth, not at 6 months or at 18 months of age, but we've really been pushing to do these studies with long-term outcome, and I think that is so important. If we improve child outcomes, we improve the health of the nation. I mean, there's no question. We get kids who are born of a normal weight, we reduce heart disease, we reduce diabetes, we potentially can even reduce cancer. I think it's such an important thing. Thank you.
Last question.
Michael Masal, University of Chicago. I really was intrigued by your last statement to have more a long-term and life course kind of outcome. And I had the opportunity to spend time in Australia, and I was talking to people at University of Sydney, and they were examining the impact of prenatal exposure to medications, and they were able to link their cohort to standardized testing in schools. And 15 years ago, at the start of the National Child Study, I asked a question and said, why do we have to pretend that our NIH studies have to always do the psychological and the educational testing? Because that's a legal requirement of schools. And to date, we have not solved this kind of problem. And I think there should be, between NIH and CDC and the Department of Education, consensus guidelines, and they were needed yesterday, not right now? Could you comment?
I think your point is excellent, and I could even take it further. You know, I'd love to be able to link medical records from the mother to the child. I'd love to be able to link medical records from one hospital to another. I'd love to be able to link it from someone who's living in one state to when they move into another state, and the child outcomes as well. I think there is so many opportunities, and you know, it's interesting. The idea for precision medicine of being able to use the electronic medical record, which, you know, I still see patients half a day a week. I know what our electronic medical record looks like, and I'd be a little scared to do research necessarily on that electronic medical record. That said, if there's a push that this is important and it's made easier to do, maybe there is a future for what you and I both want.
Well, thank you very much.
Thank you so much.